Pues muy buenas tardes a todos, qué gusto verlos por aquí, los que nos acompañan en persona y también los que nos acompañan vía remota. Es una tarde muy especial, hoy en el marco del 36º aniversario del Instituto Nacional de Salud Pública. Tenemos este seminario que es una coproducción entre el Centro de Nutrición y Salud y el Centro de Investigación en Salud Poblacional, sobre un tema por demás pues novedoso y excitante, ¿no? Realmente tenemos el gusto de contar con la doctora Anita Hardon de la Universidad de Ámsterdam y la Universidad de Wageningen en los Países Bajos. Pues realmente nos va a platicar de una metodología muy novedosa, muchas veces mal entendida, pero que ya lleva una larga tradición de aplicación aquí en el instituto, en una colaboración entre investigadores del instituto y estas instituciones. Entonces, pues miren la forma en que vamos a organizar esto. Primero daremos la palabra al doctor Horacio Riojas para que nos dé un poco de contexto sobre trabajo en esta área. Después daremos la palabra a la doctora Mara Telles, quien es pues la contraparte del instituto en estos trabajos. Y después pasaremos ya con más detalles a la presentación de la doctora Hardon. Entonces, sin más preámbulo, Horacio, por favor.
Muchas gracias, Bernardo, y buenas tardes a todos. Yo voy a ser muy breve, solo quería contarles que pues este seminario es en realidad una muy feliz coincidencia, este trabajo que hacemos entre el CINIS, la Dirección de Salud Ambiental del CIS, y este seminario con la doctora Anita, coincide justamente con el lanzamiento de la página de Salud Planetaria, la página del Programa Especial de Salud Planetaria, que tenemos aquí en el instituto, que echamos a andar, empezó a trabajar el año pasado, y justamente trata de coordinar los esfuerzos que diversos investigadores de diferentes disciplinas, de diferentes centros de investigación, estamos haciendo alrededor del problema de la salud en el planeta y sus implicaciones en la salud humana. Entonces, esta va a ser la página de nuestro programa especial de salud planetaria del instituto. En alguna parte tienen quiénes somos, quieres ponerlo, nada más los ejes de acción, para que se vea cómo lo que nosotros queremos es tener no solamente una colaboración en la parte de investigación sobre salud planetaria, sino también en la parte de docencia, y es muy importante la parte de abogacía, porque también queremos tener que este programa tenga una incidencia dentro del instituto, alrededor del instituto y en las instancias gubernamentales y no gubernamentales con las que trabajamos. Entonces hemos hecho un grupo de trabajo donde están desde antropólogos, epidemiólogos, personas que trabajan en enfermedades transmitidas por vectores, y ahí es donde hemos conjuntado todo este esfuerzo en lo que hemos llamado el Programa Especial de Salud Planetaria en el Instituto. Por lo tanto, para nosotros es muy feliz coincidencia tener a la doctora Anita aquí para que nos haga esta presentación sobre el uso de los métodos mixtos justamente en estos programas y en estos proyectos de salud planetaria. Entonces estamos muy contentos de tenerla aquí y que al mismo tiempo sea el lanzamiento de esta página del Programa Especial de Salud Planetaria del Instituto.
Gracias. Pues buenas tardes a todas y todos. Para mí es un gusto, un orgullo y una felicidad tener a Anita Hardon aquí. Pues es el resultado de una larga colaboración que empezó con la doctora Lisa Roberts, ahora con la doctora Anita. Y déjenme platicarles un poquito quién es Anita. Anita es profesora de antropología de la Universidad de Ámsterdam y la Universidad de Wageningen, como dijo Bernardo, le salió mejor que a mí. Ella ha trabajado en estudios multicéntricos y voy a citar lo que dice. A menudo métodos mixtos, pero siempre colaborativos, que generan conocimientos sobre el uso de tecnologías en salud global en la vida cotidiana y la dinámica de la atención y la formulación en políticas involucradas en su provisión. O sea, la colaboración está en la genética de su trabajo. Y bueno, ella en la Universidad de Ámsterdam fue directora del programa Research Priority, Prioridades en Investigación, con un enfoque interdisciplinario en salud global, en donde trabajó con antropólogos, epidemiólogos y una gran variedad de disciplinas. En los últimos 3 años es parte del board de la equivalente al National Science Foundation en Europa, en el área de Ciencias Sociales y Humanidades, de Países Bajos, en donde es responsable del programa interdisciplinario y transdisciplinario, lo cual la pone en la perspectiva de las agencias financiadoras. Y quienes hemos incursionado en los métodos mixtos sabemos que esto es un gran tema, la financiación de este tipo de proyectos. Entonces también Anita tiene esta perspectiva que creo que nos puede enriquecer mucho, además de todo lo demás. Y bueno, yo nada más para motivar esta plática, quisiera decirles que ella es responsable del programa de conocimiento, tecnología e innovación de la Universidad de Wageningen. Y para mí ha sido un gusto y un gran interés el trabajo que iniciamos hace 10 años, Lisa y yo, donde ella como antropóloga, yo como epidemióloga, les puedo decir que esta colaboración ha cambiado mi manera de ver la investigación. Mi abordaje a la investigación es diferente después de este trabajo conjunto con ella y les voy a decir por qué. Para mí, el fin último de mi trabajo de investigación es incidir en la salud ambiental. Y me parece que cuando uno viene desde los métodos tradicionales, impone el marco conceptual del investigador. ¿Qué se quiere saber sobre qué tóxico? El instrumento de medición impone un montón de hipótesis y supuestos que están detrás de lo que estamos aplicando. Lo que he aprendido a través de los años con la colaboración de Lisa es que estamos dejando afuera las decisiones, el comportamiento, las relaciones de la población que interactúan con ese medio ambiente que queremos modificar y que queremos cambiar para mejorar la salud ambiental. Es por esto que a mí empezar a trabajar con métodos mixtos ha sido fascinante y un cambio bien importante en mi forma de ver la investigación. Desde esta colaboración llegamos a trabajar con Anita, en donde aprendiendo de su trabajo que está haciendo en Filipinas, estamos adaptando sus métodos al estudio que estamos haciendo Lisa y yo en las Cortes, y ahora Anita está adaptando nuestros métodos a los suyos, y es una colaboración que promete mucha riqueza y para los dos sentidos. Entonces, Anita, una felicidad tenerte a ti. Muchas gracias por estar con nosotros. Adelante.
I'm honored to be here now. This planetary health site and collaboration institute has been established. And I think it's a wonderful, must be something good going on that I'm here right now. So when Dr. Mara asked me to present on using mixed methods in the face of global planetary health challenges, I had to think for a while because I realized I could do a course on this. It would be a full semester, I think. And there was so much I wanted to share. And then I decided what I'll do is I'll stay close to what my experience has been in doing mixed methods in global and planetary health and reflect a bit on how this worked out. So what was the mix here in the methods for 4 different projects. So I'll take you along with these 4 projects, but overall reflecting on what these projects do. Can you read? Yeah. Is that actually what me and my colleagues in the global health priority area in Amsterdam, University of Amsterdam, came up with is that what we really need in the face of planetary health challenges is kind of open-ended and flexible research programs. If we fix it too much at the beginning, we actually might lose out on understanding the planetary health problems. And what we were doing along the years, 10 years I worked in that program, is we We both aim to better understand and better just describe the problems, but actually there's a lot of that. So if you read the literature, endless descriptions of the problem. And what we really wanted to do is go one step further and learn from existing interventions in the field of planetary health, because we see all over the world, so many people are responding to the challenges, trying out things to make it better. I'm sure all of you, even in your own lives, are doing that. So we as individuals and collectivities are facing the challenges and trying to improve the situation. And what we set out to do was to learn from these collaborative, the word you mentioned it, collaborative efforts to improve planetary health, and to see what the outcomes are of these interventions, but also, and maybe more importantly, and this is where the anthropologist in me becomes visible, the mechanisms of impact. So not only is there an impact of this intervention, but also how. We make fun of studying the situated howness. How does this work here? So my colleague epidemiologists in the University of Amsterdam, they would often want to come up with universal understandings of what might work. Vaccines, AIDS medicines, malaria medicines. But as anthropologists, we brought in, no, we need to understand how this technology or this intervention works here. How does it make an impact? And how might it work somewhere else? So overall, these have been the aims of applying mixed methods in planetary health. And in terms of the framework we use, it's biosocial, or let's say planetary health social. And I don't know if anybody of you knows this donut framework, or everybody. Has anybody seen this? Yeah, you've seen it, yeah. So what I like about this framework is it connects in the middle the kind of social that we're after as societies, while at the same time, at the outer boundaries, wanting to keep in our picture the planetary boundaries. So we're actually looking for a good enough life, good enough quality of life in terms of all kinds of social, economic parameters, and not going over the planetary boundaries too much. So the 4 projects I'd like to share with you, and I'll zoom in on the mix of methods we used in these projects. There's 4. So embodied ecologies, chemical youth, one which was about improving an AIDS program, and another, and I know that Mara and Liz are also doing that, collaborating with designers in improving a water system. So 4 really different kinds of project. And the first is the one that I'm working on now. And it's also the one in which we are exchanging notes on the methods on how to go about this. So this is the first case, embodied ecologies. And the background of this project is that, and it's of course one of the planetary boundaries, that chemical pollution is increasing. And actually we know very little. I'm very happy there's cohorts going on that Dr. Mara is involved in, which are trying to figure out the effects of all of these cumulative pollutions that we are living in. But as an and of course we know too little about these pollutions. So this is a major problem. In the mixed method studies, and as an anthropologist, what I'm interested in is how people live their life in this polluted world. Yeah, sorry, I should have said that. There's lots of policies, but I know you know these policy contexts to clean up, especially in Europe, where I live. We are looking for clean environments. So we have an end to pollution policy in the European Union. I mean, end to pollution. I don't know when that's going to happen. But what we're really interested in, and my project focuses on cities, is how people live their lives in this polluted environment. And in this polluted environment, in our concept, they are living their life in pollution through multiple channels, through air, water, products, food, the soil, and all of this comes together. And we're studying now this cumulative toxicity from the perspective of people who are living their lives, and we decided to focus on cities. So we're doing this in 5 cities, 2 in Europe, where there's this end to pollution policy, and 3 in Europe and 2 in the Philippines, where I did studies before. And this is the multidisciplinarity that we're involving here. And I'd like to highlight that we're working also with a field called experimental governance. I don't know if you know this field. This is a field where you learn actually from initiatives to improve. And so this also fits with our aim of learning from initiatives to improve and not just describing the problem. Experimental governance is a field of political science, actually. And so it also shows that when you're doing a study, you always need to find the relevant disciplines. Sometimes we do mixed methods between 2 disciplines because we know each other and we just keep on developing. But I think a lesson is that if you're taking on an issue, you have to think really well about which disciplines do I need here for this question. So it's always related to what you want to be doing, what you want to be studying. We want to study how people make a living in cities that are maybe permanently polluted with all the persistent chemicals around. And we need people from experimental governance to help us study this. So we're doing this, it says 4, but it's become 5 cities recently, 2 in Europe and 2 in the Philippines. And you can imagine the ecologies are very different. So in my multi-sited studies, I always try to go with contrast. We can learn a lot from contrast. In the Netherlands, we swim in the canals. And you can see the upper left, in the Philippines, people work to get the valuable plastics out of the canals. Very different setting, heavily polluted places, and very different also infrastructures. So these are the ecologies in which people live. And in our approach, we're interested in how these ecologies are embodied in terms of how people live their life in these infrastructures and how they also are affected with cumulative toxicities. But even more, and you see that there in the 3rd project, we want to co-create, and this is where experimental governance comes in. We want to co-create harm reduction policies to improve. We think we don't have enough time to just study, we want to improve. So the method, and here comes the mix of methods then, are urban ethnographies. This is about how the chemical human interactions in communities. And this is where we're collaborating to map these chemical human interactions, including in the houses where there's lots of products that people are using, but also the outside the houses. And we're also using, and this is another method that we think we need in order to map these cumulative toxicities, we're using cartography. And here you see an outcome of a cartographic experiment that we did, where people were mapping where they feel good and where they don't feel good in the city. And we found out that one of the places where they don't feel good is commuting hubs, where you have to wait from one bus to the next. And why don't they like these commuting hubs? Because they have to wait, and the little buses keep their motors going, and people are smoking while waiting. So this is a hotspot of toxicity. And through these cartographic methods, we're able to define cumulative toxicity hotspots. This is one of the aims that we have. These will be hotspot places that we will study further with our colleagues in environmental health. But the ethnography helps us first, and the cartography helps us find these hotspots. But we also learn from ongoing harm reduction initiatives. Here you see a lot of initiatives around our sites for cleaning up plastics. And we've been describing these plastic initiatives in the 1st phase of the project that's actually just starting. And you can see there's many different initiatives. And when we were reflecting on these initiatives through a kind of experimental governance approach, we realized that most of them are at the end of the pipeline. They're cleaning the plastic once it's in the environment, and very few are oriented towards reducing plastic pollution. So this is an example of the harm reduction method that we're doing through experimental governance. So in the end, the framework that we have is try to to improve harm reduction in cities and develop tools for that. Okay, the second project, and I'll do this one a bit faster. Just want you to see that the first project came from the second one, and that was where in the second project, we are learning about the way young people live their lives through chemicals. In this project, we used a very different mix of methods, so not with environmental science and not with people doing experimental governance, but actually a mix of anthropological methods. Can also be a mix. And what we innovated in anthropology is that we wanted not only to do a small scale study, that's always the critique of anthropology, but we wanted to do many ethnographic descriptions of what young people do with chemicals. And we ended up doing that. So why do young people use all kinds of chemicals from shampoo to their toenails? And how do they do it? We're also interested in the practices. And these are the sites, 12 sites that we did these studies. And these are the methods that we used. I won't go into detail, but the importance here is the mix of methods is about triangulating, which is important in anthropology to get more validity. You don't use one method only. Qualitative coverage is not so high, but you use different methods. And when you find the same pattern, then you feel that you have a valid finding. And what did we find? We found that young people are using these chemicals for reasons that the policymakers didn't think of. So they are for many different wellness reasons, not only recreation and to be high, but also for work. And we highlighted this towards the policymakers, that a lot of the chemicals are used to have stamina for work, energy drinks, or in the Philippines to have a white skin in order to have a so-called pleasing personality to get a job. And these were aspects that had not been seen before. So we learned that those situated practices with the chemicals, actually we can analyze as reflecting precarity of their everyday lives. And at the same time, we learned that when young people are using these chemicals, energy drinks, but also MDMA for parties and whitening creams, they're also always balancing, Liz calls it grappling, with benefits and harms. So it's not that something is good or something is bad, the material thing, but it's balancing. I'm sure you recognize that. You're always balancing the benefit. I do that with coffee. I nearly took a cup of coffee too much, and then I would be not a very good speaker. So we're balancing the benefits and harms. And this is the theoretical framework that we came up with in terms of how they are doing that. They're doing that by talking to others. They're doing that by tinkering with dosages. So there are all kinds of ways in which they are balancing. It's a cycle. And it also led to policy recommendations. I saw in your planetary health program, you want to give policy recommendations and have action. So this research, which as anthropologists started from what young people are doing with chemicals and how they do it, led to new ways of dealing with them. Now, I don't have a clock here. Does anybody know what time it is? I can go on? 2 cases only, got 2 more to go. Okay, so you can see here that we pushed for a move away from health education, which is usually on a chemical by chemical base, like energy drinks are bad for you or MDMA is not good for you, and to a way in which we were promoting for a deliberation with young people on the chemicals they are using and recognizing that they are balancing benefits and harms of chemicals, of all chemicals they use, and pushing for policymakers to support young people in expressing that agency of balancing or grappling. So it's a different approach to health education. And in Amsterdam, we see that in the town where we did field work and my university was based, Amsterdam has a very strong policy of doing that. So they support peer groups to go to festivals, to teach young people who are going there for the first time and trying out ecstasy for the first time to be careful and to drink a lot of, not too much water, but drink water. And they give them with tea and bananas if something goes wrong. So there's a strong support of this balancing of benefits and harms. And we saw that as a model, which we called harm reduction from below. You can see that in that project, which preceded the embodied ecologies one, that harm reduction is the understanding that we took to the next project. So we think in dealing with pollutants, but also in dealing with products you use in your everyday life, we need to support people to reduce harm. You can't do away with it altogether because for the environment, it's just too polluted by now, but we can find ways to reduce harm, and we want to strengthen that from below, help people reduce harm. So this is a third project, which is an earlier project that I did. And this is a project in which I worked very closely with epidemiologists. So the methods were epidemiology and anthropology. And this was a time at which AIDS was a big problem in Africa, really in the countries where we worked. Between 1 out of 10 and 1 out of 2 people were infected with HIV and AIDS. And treatment programs were being set up. And the beginning of a treatment program was to be tested if you have HIV. And one of the key problems that the policymakers were facing is that people were being tested, but then they were lost if they were HIV positive. And they were pushing people to, once they are tested and they are positive, to tell other people about it. And this model came from models in the United States, where AIDS activists had pushed for people who are HIV positive to share their status, to be open about it. And the idea was that if you don't share it, you're too afraid and there will be big problems. So you should disclose. That was the emphasis, especially, of course, to your partners, to your partner. And so we did a multi-country study. This is a mixed method study in terms of epidemiology and anthropology. So there were people being identified in clinics where they were being tested and asked to join the program. We had a survey, which was closed questions and open questions about whether the test experience, also about whether they tested positive, if they had a partner, and whether they disclosed. And we did an analysis, the epidemiologists with whom I was working did an analysis of the findings. I'll come back later. So we did a nested study in there on the HIV positives. But when we, let me explain this first. So I want to give you the findings first. It's here. So the key finding there was that we found the usual things that we expected. Men disclosed more than women, higher educated, disclosed more, and people living in urban areas disclosed more. This is what we expected. But we found one thing that we didn't expect, and that was that people who were in support groups, which we thought would make people feel more comfortable about sharing their HIV positive status, disclosed less. So then we did a nested study in this big quantitative study. And we could do that because we had open-ended questions in the survey. That's a kind of not always the case, but we decided early on to probe on a couple of issues, and that was the anthropologist working with the epidemiologist. So if you said, did you disclose? No. Why not? Open-ended question. And people could tell the survey, the interviewer, why, and the interviewer would write it down. So we had in our data set a lot of answers to the why did you not disclose. So we decided to analyze those why did you not disclose first. And that's what the nested study was. You see down there, we had to select the ones from our database who are HIV positive and the ones that had a partner. And then we looked into those 231 cases. You can see we had a big sample, and in the end, only 231 that fit the inclusion criteria for looking further at disclosure. And then based on that, we found a lot of reasons for not disclosing. And that is that overall, the reason was that fear for stigma, but also the support group already provides support. So they didn't feel they needed to disclose. And when we did a multivariate analysis, we found indeed that support groups were the main reason for not disclosing, which is an interesting finding. And of course, it has implications for policy, because the policies were pushing people in counseling, you have to disclose to your partner. And what our qualitative data in the survey and in additional open ethnographic interviews and focus group discussions showed was that if people did that, especially women, they would often end up in trouble. So there were very good reasons for women not to disclose, and the support groups were providing them support. So we came up with a policy that understood that maybe disclosure is not the imperative. Maybe when someone tests positive, especially a woman, you don't have to push her to disclose to her partner, but you should push her to become a member of support group to deal with the stigma and to find ways to deal with it. The funny assumption also amongst the researchers who did the disclosure imperative work in terms of policy was that everybody would still be having sex with their partner. It's not necessarily the case. And women could have other ways of not putting the partner at risk. You don't necessarily have to tell them you're HIV positive. So it led to a change in policy. And this is the article. And you can see this is we work together with epidemiologists and anthropologists here. So the fourth case that I want to discuss is a case where we collaborated with engineers. And this is from my more recent work at Wageningen University, where there's a lot of engineers. And I'm really impressed. I don't know how many engineers you have here in this institute, but my colleague engineers, they're going to solve all the problems. So we have the planetary health cycle, and on all aspects, it's solvable. They keep on telling me it's solvable. So there's also a solution to the water issues in the Netherlands and in new neighborhoods, but also in small scale interventions. We're trying to develop mechanisms of reusing water. This is the mechanism. And one of my colleagues participated in a study where they were testing whether this system works in terms of making the water safe enough at the end. So there were all kinds of filters through which you could reuse water. And the water was being reused, among others, for the toilet. And what do you think they found in terms of this system? If you reuse the water for toilets, do you expect any problem from a human perspective? I expect our anthropologists to think about that. Yeah, depends on. So what these people living in the eco-village saw as a problem was that the water that came back into the toilet was yellow. So it looked as if the toilet was dirty. So what did they do? They put up a message in their toilet for the visitors. You might think this is dirty, but we have a complex system to reuse our water, so it's not dirty. That's why it's yellow. But there was another problem. And the other problem was that the whole system wouldn't work if too many pharmaceuticals enter the system. And especially in this eco-village, there was one person who was transgendering and using a lot of hormones, and the hormones were coming into the toilet. And they had a real issue that they had to tell this person to use a compost toilet outside of the system, because otherwise the whole system would be problematic. But the water engineers told me that they also, when they apply this in bigger neighborhoods, have a problem that if people are using chemotherapy, that could also affect the whole system. So how do they go about people who are polluting, as it were, the toilets? The interesting thing was when I discussed this issue together with water engineers at a big conference they had, I said, but why didn't you ask the people how they could inform people in the neighborhood about this problem? I'm quite sure that people who are using medicines that might be a problem for the system would be willing to do something else in order to have a good water supply. But that was not in the mind of the engineers. The engineers were just trying to reuse the water and saw people as polluters, as a problem, and not as participants. And that brings me to something that's key in this case, and that is a methodology that I was also pushing very much in the National Science Foundation and responsible for. And that is that we also need not only interdisciplinary, we also need transdisciplinary research. And trans in the Netherlands means that you involve citizens and stakeholders in defining the design and designing the studies. So it's a collaborative approach. And in the Netherlands, when I was there, as I just stopped in December, as head of the, as board member in the National Science Foundation, I was responsible for this program that's pushing transdisciplinary research. And we had 100 million for it a year. And the whole idea was to have, to fund programs that would involve multiple stakeholders in designing the study and in doing the study. So in this case, the people here would be co-researchers and not just polluters of the water. And they would also help redesign the water technology. So I think that moving forward in the area of planetary health, it's a good idea, especially in the area of design, and this is what I'm pushing with my colleagues in Wageningen, to do more human-centered design, where the design of these solutions that my engineer colleagues say are easy to do, becomes iterative. So you try it out, you improve it, and you try it out again. And it becomes a whole cycle where also in the planning stage, in a transdisciplinary approach, you can already involve different stakeholders for the issue at stake. So I promised Mara I would end with some of the challenges. So there's real challenges, I think, in doing interdisciplinary research, and I've been finding that out working in the research priority area, global health, but also in my new job. And that is that when you work together as people from different disciplines, you're really doing different things. You're using different techniques. You're studying different objects. And what you find out has different implications for action. Do I have a couple of more minutes? Yeah, okay. So an example here with the different techniques is the way my country responded to the COVID epidemic. I'm on the board of the National Institute of Health and Environment that was in the driving seat, deciding what needed to be done. And the head of infectious diseases there was aiming at less people in the hospital and doing that in an evidence-based way. So the evidence was distance, 1.5 meters. He was completely against using masks because he didn't have the evidence from a randomized controlled trial. Whereas other people in the Netherlands who are more into looking into water to air flows were saying, but you could see the virus is going, so we should have air filtering, air purifiers. I saw that in the site of Progress and Elemental, you have them in every room. We should have air purifiers to stop the viruses, and we should wear masks. Better be safe than sorry. But my colleague, infectious disease virologist, wanted the evidence from a randomized controlled trial. So that's a different way of knowing, and not a kind of what I was promoting, an open-ended, flexible way of knowing. And I was saying, why can't you do a study of the schools that have air purifiers and the schools that don't, and then just see which ones have less infections? But it was all focused on existing evidence and focused on the virus. So if you're focusing on viruses as they go through the air, that's a different object of study than if your focus is on viruses entering bodies and people in hospitals as the outcome on which you're making your policy. So the last one that I wanted to mention here is the technique of talking to people. So my anthropology friends who were talking to people with COVID, they said, we don't want to be alone all the time and not go out due to lockdown. We create bubbles. I'm sure people here also did that. So they had their bubbles where they're not using masks, and they use masks to the outside world, but not in the bubbles. And I said to the people at the National Institute, can you advise people to be in bubbles? No, there's no evidence for that. But actually, that's how people are resolving the loneliness of lockdown, by being in a bubble and eating together and not taking the precautions indoors, but taking the precautions outdoor when you're with strangers or with people who are not in your bubble. So throughout the whole COVID epidemic, I was in a bubble with my father and his girlfriend and my husband, and we were very cautious outside, but there was no support for this policy. So different techniques of knowing, anthropological technique of knowing, we don't want to be lonely, we will be a bubble, and different lead to different recommendations for action. But there's also other challenges, and that is very few windows. We were discussing, it's very hard to get funding for interdisciplinary research. You have to kind of declare to one different paradigm of research to get the funding. And also, maybe we didn't mention yet the publication challenges. In my experience, when you want to publish, you have to decide, is it going to be epidemiological or anthropological? And then you have a chance of getting published. When you publish a mixed method paper, the one on the support groups was a mixed methods paper. It's not so easy to get it published. We published it in a specialized AIDS journal, so they were interested, but we had to make the anthropology just as an illustration of complex multivariate analysis. So it was just like a footnote to the actual analysis that proved that support groups were a key variable. In doing transdisciplinary research, where you involve citizens and stakeholders, it's even harder because there's just different groups and they have different power. So how do you give the people who are in the eco-village worried about the yellow water real power in designing the technology? Or how do you give the people in the focus group discussions and the ethnographic interviews living with HIV real power to decide their AIDS policies? Or the people that we're working with in the Embodied Ecologies project who are worried about the toxicity of the air in hotspots, the commuting hubs, how can they really influence the policy of their municipalities? And that kind of unequalness is something that I think is a great challenge in planetary health. Leave it at that.
Si hubiera preguntas o comentarios, les pedimos identificarse y un poco su posición y expresar la pregunta.
Thank you, Professor, for this insightful and very interesting presentation. I'm Germán Guerra. I'm a health science researcher here at the National Institute of Public Health. And I have a question regarding the challenges you mentioned on your last slides. And given all this expansion from the last decade of these deep learning techniques and artificial intelligence techniques as a way to make science and make findings of research, where does the mixed methodology fits in all this new expansion and avalanche of new techniques that are very complex and they're actually aiming to predict human behavior? So what are your insights on that? And where is mixed methods standing against or besides these new techniques? Thank you.
Thank you. That's such an important question. And actually, I think AI and also complexity science is really important for mixed methods research because it allows us to further test hypotheses that we might get from these kinds of observations that I do as an anthropologist. But through AI, you could also get other observations that you further want to study. So I think it just expands our toolkit. I work with complexity scientists in a project that I didn't put there because can't do too many projects on diabetes. And what we did was we were going back and forward between doing ethnographic observations and doing complexity modeling to see what we think the situation is, and then using big data sets to test our models. That we have cohorts on health in Amsterdam. So there's an ongoing cohort, but we would first do this kind of collaborative complexity modeling to come up with hypotheses that we can use big data to test. And I think there's great opportunities there to be iterative and so actually open-ended, as I said, and flexible in trying to understand situations. Just give you one little bit of dynamic that we put into the model, and that is that the municipality really wants to fight obesity, so they're pushing people to walk. And then they found out that people, Turkish and Moroccan women living in the New West area, they don't like walking on their own, so groups, walking groups. What we saw through observation of those groups is they lead to more eating, because it's lovely to be together and to walk. A little bit of stroll in the park, picnic, everybody brings food. So perhaps those walks don't work, but you need to observe it first. We could then do data analysis with all the cohort data we had on the factors that are leading to less diabetes. So using this concept, this complexity thinking.
Thank you very much for your presentation. It was really insightful. I'm Jürgen. I'm studying public health and social and behavioral sciences. And it was amazing to see how qualitative methods are being used in several different areas. And my specific question is about how can you push forward this evidence that qualitative methods give you when mostly public policies are being based on numbers and indicators? And it is really hard for qualitative methods to show an indicator or a number and thus creating a change in the stakeholders' decision. So how is like to push these mixed methods into public policy creating or just implementation of any project?
That's such a good question. And in the little group that we have here with Mara and Liz, I've been learning a lot from the collaboration they have going on. So what I've learned is that Liz did in 6 families some observation on how people deal with water, which then led to a project in which they studied that in 60 families, which then led to questions in the national survey, representative survey in the whole country on water usage. So I think that's the way to go, that you as anthropologists, I'm against being, we need to connect to the survey. So you saw also with the HIV survey I showed, that was a survey about reasons for not disclosing, but we didn't completely understand it until we did observations. And ideally, you could then do another survey. So I think it's good to link methods. And in mixed methods, sometimes they're done at the same time, quali and quanti. That's fine. That's what we did in the survey. There was quali in the quanti, but then you needed more quali to better understand. And then you might need more quanti to test your hypothesis. So that's the open and flexible and iterative approach that I'd be pushing for. And that's why we need to collaborate.
Yeah, I think now it's better. I really thank your question, because that is linked to my question. When I describe the collaboration and that we have had, Lisa and myself and the team that is working on this, I'm very proud. And I share the story, super proud, because we started with 6 families and now with a national level, no? With getting information at the national level. But it took us 10 years.
Yeah.
It took us 10 years with no stop. So my question is related to time. How was the time in the examples that you present us, in these 4 examples? And how successful were you on changing things in the real lives? That's one question. And my other question is, I think that in the collaboration that we have followed, and your question made me think on that. We are surrendering to the number, to the hard number, that it's a prevalence at the ENSA node will change things. And that was, we walk on that direction because I have the experience with the lead exposure. A prevalence of lead poisoning made more changes than 20 years of research. But we're surrendering to the big. So my question is very general. How do you perceive time in this kind of collaboration? You talk about 4. I would not have life enough to finish the second one. So how will you manage results, successful results changing? Have you been able to change? You know, I'm not clear. I think I'm very confusing, but.
Yeah, I think that's a really important point. And right at the beginning, I said, I think mixed methods research is used a lot to describe the problem. And I have an impatience like you have, and many of my students have, that we need to move faster. If we are talking about planetary health and the planetary boundaries, we need to speed up the transition. So this is one of the major aims I have for my new job with knowledge, technology, innovation is how can we speed up transitions? How can we do that? And I think part of it is to do with not only looking at the problem, but studying the potential solutions. So can we go and see where people are trying to solve the problem and learn, or cities are trying to solve the problem, or institutions are trying to solve the problem, and can we help document not only the outcomes of the potential solution, might not be a solution, but also the mechanism of impact. So we really understand how to change. So research for transformation, research for speeding up transition. And when I was in the board of the National Science Foundation, we set up a new program for climate, and we decided to focus on speeding up the transitions. Our people at the National Climate Institute, they wanted to do modeling of the problem. We know there's a problem. Can we set up a scientific program to speed up the transition? How can we act? And I think that's the challenge that we're facing. So as scientists, the science policy cycle is create the evidence, like my colleague from the National Institute, he had the evidence on distancing as a good way to stop the virus from spreading. So he wanted that as the main policy. But other people are trying the mask. So can we speed up maybe, you know, our response to the epidemic by wearing masks, which other countries, I think in Mexico, it wasn't obligatory, was it? But people were still doing it a lot, or institutions were requesting it. So how can we build on transitions already there, document outcomes and mechanisms of impact of those transitions? In your case, with the water, yes, I think it's really important. It's in the survey, but at the same time, I think there's other ways you're working with engineers that you can already improve the quality of the water and measure that, perhaps.
Can we take that?
Yeah, I think that'd be better.
Is there a question there?
There's a question over there, Anita. You want me to translate, or can you get it from there?
What's the
What has been the biggest challenge or
biggest challenge about
transdisciplinary? And the other
Yes.
one from the social anthropology. Oop, it's gone.
What's the biggest challenge? Yes. In transdisciplinaria. So I think at the end, maybe I went a bit fast. I think the biggest challenge is that often people are involved in the research, but they don't really have a say about what the problem is that's being studied and how it's studied. So they become like cheap data collectors, citizen scientists. And so how do you then really give people voice in defining the problem? That's even more a challenge if you think of funding, because to get the funding, you know, I've got funding for 5 years now for this embodied ecologies project. You have to say something to the funder to get the funding. And now I want to give people a say in deciding what the toxicities are that matter to them. And what the toxicities that matter to them, I find out, are not necessarily toxic chemicals. They speak about other toxicities, which have to do with having to travel long through bad traffic because you live very far from your work, or toxic work relations, or stress because of poverty. That was not in my definition. And so now I'm struggling to define toxicity broader than just chemical toxicity. I hope my funder will not be too angry when I do that.
Había otra pregunta. Venía en el mismo texto, en el mismo chat, creo que venía otra.
In the collaborations, in the teams, in the research teams. Yeah. In a general question, yeah. So gender. Yeah. So gender. Yeah. So gender is always part of my research, I think. And so you saw also in the HIV/AIDS research, for example, gender is an issue. You have to be open. You never know what the gender dynamics are going to be, but it's always an issue. Yes. True. Thank you.
Hi there. Okay, so this works. Anita, that was fantastic, and it gave me a much more sweeping overview of all of the things that you've done. And so I think I have more of a commentary about time, which feels like it's addressing you, but maybe everyone here. I mean, I think one of the things that's been complicated and a frustration in our in Mara and I's collaboration is that time can feel like an issue because ethnographic work, anthropological work can seem like it takes a lot of time for people who generate numbers in ways that seem quicker to them. So doing a survey, if you've decided in advance, these are the survey questions, we're going to go ask 100 people or 10,000 people. We have the survey, we can do it, we know how to do it. And then we can analyze that data because it's all numerical. And then along comes an anthropologist and they're like, no, we're going to take some time to figure out what the relevant question is. And one of the things that I think, you know, we're both now promoting is you're potentially going to make a better number if you take the time to figure out what the right question is. So maybe you can generate the numbers quicker without including the anthropologist, but those aren't necessarily going to be very meaningful numbers if you haven't taken the time to figure out what the right question is. But I think one of the things you're showing that's really interesting is that in some ways you've been positioned really differently in many of these studies and projects than the anthropologist has been in some of our collaborations. And you've been in positions to have the anthropology there from the beginning. And it seemed like there was an assumption that, yeah, we're going to take the time to do the ethnographic work. So that wasn't what was at issue. And you're instead saying, so I feel like anthropologists are always saying, slow down, slow science, at least take time to hear what we have to say about this. You're saying there's a method when you have more methods and more voices at the table to figure out how to speed up, how to react. And that's what you keep saying by transition. Like, we don't need to just say, we only know the evidence about the masks, so that's what we're going to do. It's sort of like, let's do all the things quicker and figure out what the right response is. And I think that's a different question about time. Like, there's two different kinds of questions about time. And I'm really maybe you could react to that or say something, but it's just been really interesting hearing you talk about time in a different way than the standard way we've been talking about time.
Yes, it makes me think that in the beginning, so I did a research priority area global health as a co-director for 10 years. When we started, I was very frustrated because my epidemiology friends would come to me. They weren't friends yet then, no, colleagues would come to me and they would say, we have a problem. We're starting this vaccine trial and people are just not signing up. Can you send a student to help us figure out why they're not signing up? I said, send a student. In the beginning, I did. And then after a while, I stopped doing that because I was as free labor supporting the student to do questions that they hadn't thought of in the beginning. So that's when I started saying, well, no, I'm not going to do that as an anthropologist. I'll only collaborate with you if you work with me from the start. And that's when we applied for the funding for the priority area global health with a anthropology, epidemiology, two kind of partners on equal terms. And that's when we started, but it took a lot of work to really get at the kind of joint programming. And in terms of time, I don't completely agree that quantitative research is faster, because my experience with the people doing the surveys is they take endless time to clean up the data and they're always working on the analysis side of it. So that takes time as well. Maybe other people are very fast at that, but my colleagues in surveys have been quite slow. So in a way, you catch up as an anthropologist. Yeah. Yes, and we have been experimenting with large scale anthropological studies. So 400 interviews per city and analyzing them with software. So, you know, it's not AI, but still kind of quantifying the analysis, not coding it, but using clouds and things like that to get at themes. So we're speeding up indeed. We're speeding, maybe we're becoming less anthropological, but we're speeding up and doing open-ended questions in the surveys, which we again analyze with software. So there's ways, I think, also of speeding up, but the speeding up is because we see the urgency of the problem. That's the speeding up. Yeah.
Pues miren, desgraciadamente por razones de tiempo necesitamos cortar, pero creo que ha sido una plática por demás inspiradora. Creo que todos nos quedamos muy complacidos de que existe esta colaboración. Es un impulso muy fuerte para el grupo de Salud Planetaria y creo que para todo el instituto. Creo que todos salimos de esta reunión pues un poco arrancando la cabeza de que aquello que pensábamos que era tan sencillo, ahora resulta que cuando pues incluyes otros métodos y otras visiones, el análisis y la interpretación se puede modificar, ¿no? Entonces, pues a nombre de todo el instituto, permítame entregarle un reconocimiento a la doctora Anita Hardon y por favor acompáñeme con un aplauso para despedirla.
I hope we can continue to collaborate also with the planetary health.